will be walking through the Arms Medical Vaginal Dilator. This dilator itself was designed by Dr. Veronikis when he was a fellow at Harvard, and he developed this system so it will allow for a very minute and unique vaginal lengthening, which actually allows the patient to self-adjust to help the patient actually gain some vaginal length. And so it has a very versatile tip selection. So 3 different tips come with this set. 2 different style bases come with this set. One of them that you can see has a larger washer at the bottom. It is that you use when you're sitting down. And then this smaller base, which is the same size in diameter as the tips, is for sleeping at night. And so it can be placed in the vagina, and it doesn't have the base on it. And then it comes with 2 washers that adjust in height, and it has 1 extension that, depending on the patient where they start at, some might start at this particular length, or some might start at a smaller length. So this will allow you to go from 1.5 centimeters all the way up to 13 centimeters in length. So you might be asking, who is this for and why was this developed? This particular device was developed for women that have vaginal tightness. They might have some painful intercourse due to particular pelvic floor dysfunctions, also known as vaginal atrophy, or different types of dyspareunia. They might have vaginal narrowing and similar conditions, or they might have actually been born with a very short vaginal depth. And so the style of dilator allows the woman to make these micro adjustments, and they don't jump up too quickly like some of the other dilators that you would currently find on the market. The whole idea is that you can gradually increase that overall length over time at your own pace, as only you would be able to know how quickly you can expand the dilator each day that you would currently use it. So how to appropriately use this 8-piece dilator system. Either you can get fitted at an office. Sometimes they'll actually fit it in the hospital, or you could be fitted at your physician's office, or if your physician writes a prescription for it, it could be sent to your home, and then you would be able to determine what your starting depth is. And a real easy way to determine it would be, depending on, without putting the base on, you could insert, screwing both of these together, and you can now, after taking a warm bath, you can apply a lubricant that is water-based to the dilator itself, and placing one leg up onto the side of the bathtub or onto a chair, you can slowly insert the dilator and determine the actual length of where it comes out. And so based on that, if it, say it's comes to about this point right here, we know that it is going to be one of these. itself, and then possibly the smallest washer. And so now you would then take the seated portion of it and now screw in the top to it. And once we do that, a little bit of work here, but once you do that, it's ready to go. And now you can do the exact same thing. You can put some lubricant, water-based lubricant on it, and then slowly insert it. And then the goal is that you should be able to sit down on a level type of chair. Might be a dining room chair, might be a chair in your bathroom, but you want it to have some firmness to it. And if it's too firm, you can always place a towel or a cushion on it, but not too thick, because you want this pressure, being able to do this upward pressure, and you want to be able to feel it at the top of the apex of your vagina. And so you don't want it to be painful, but you certainly want to have just some slight pressure. And if you don't feel it at this particular height, you can remove it and then slowly insert it until you feel some gradual pressure, but not to the point where it is painful. And that's really where you start. And so once you start increasing it, and you then would increase past this particular spot, then you can add the other washer to it. And from a care and maintenance standpoint, it is dishwasher safe. You can hand wash it with soap and water. You can throw it in your dishwasher. And it is, if you would like to bring it back to your physician, they can put it in an autoclave. They have sterilization. Most offices have sterilization equipment at their office that they could clean it. So this plastic here is medical grade plastic. It can be sterilized any hospital setting. It can be sterilized at a doctor's office, but it is aligned to a single patient and is not to be exchanged amongst patients. So once you receive it, this is yours for the duration, and hopefully you will have years and years of use to it. And if you have any questions, you can always check out our website at armsmedical.com. And if you have any questions that you'd like us to answer, you can always fill out a questionnaire on info@armsmedical, and it'll come to us, and we'll be happy to respond.